Hello everyone, I hope you're keeping well in these challenging times. I am Judith Plante, the incoming president of the Council of the CPSO and a family physician from Pembroke. I was asked to make this little video to answer a few questions and let you get to know me a little bit more as your new president. I reached a point kind of in the middle of my career after 20 years of seeing patients where I was really starting to look for opportunities to be involved in the bigger picture, to look at the issues that challenge the profession and make it difficult to always provide excellent care despite our best intentions, and to really try and see if I could help move those discussions along. I was invited to the CPSO for a Future Leaders Day and was blown away by the passion and dedication of the people who work there, improving care, protecting patients, making sure they are cared for safely, and encouraging and supporting our members, the physicians who provide that care. So as I started learning about the college and asking questions about the kind of work that was done and how one could get involved, I learned that my district, the Eastern Ontario, 2 seats from this district were coming up that next year. So I stood for election and ran in an election campaign for the first time in my life. I wrote a nomination statement and I got a bunch of folks to sign off that they thought I was qualified for the job, and I stood for election. I won the seat, obviously, and for the last 5 years have been very involved in the work at the college. This year coming up is obviously going to be a continuation of the challenge of dealing with the COVID pandemic. The college has been very involved over the past year in helping to give direction to the membership as to approaching the incredible challenges on the front lines and in the background, planning and policy work of dealing with this unprecedented health emergency. Who knows for sure how the rest of this pandemic is going to play out over the next year. Certainly we are feeling hopeful at this time that vaccine will really change the day-to-day approach and lead us to a much better space as we get well into 2021. I'm committed to supporting all the initiatives at the college in terms of supporting our membership and making sure patients in Ontario get the care that they need. The other big initiative that we started this past year was the quality improvement program rollout to family physicians in clinic practice. Over the next year, we will be looking at expanding that program to folks who work in hospitals and to specialists in all the locations where they provide care. So it's very exciting, and it's so much a project and program which is put to push all our membership to improve rather than the previous narrow focus on quality assurance of just really a snippet of the membership's total population. The simple answer is that the CPSO needs participation in many different ways from many different people across this province. The realities and the challenges of care in the GTA are different than Kenora, which is different again from the Ottawa Valley, which is so vastly different from our Indigenous communities in the north. And we need perspectives from people who live and work in all of those environments to make sure that our programs and policies really address the reality that's out there and are realistic in what we expect of people and realistic in what we can change and what we can support. So the decisions are better if they are brought to the table with a recognition of the diversity of our population, and that's the population of patients and the population of our profession. It has been very gratifying in the last year to see the incredible uptick in participation from our membership into college affairs, be that in the increased number of people who've applied for jobs on committees and who've run for seats on council, to the increased number of responses we get to the emails requesting your input on college policy changes, and Nancy's letters to the profession talking about the challenges and the ongoing approaches the CPSO is taking to them. And I certainly hope that this engagement continues, because as I said earlier in this video statement, it's by hearing all the voices from all the different areas that we can best improve. So I look forward with enthusiasm to the challenge ahead, and hope that as we progress through 2021, we can meet the challenges in front of us and face them in a way that improves and protects the care that we give to the citizens of this great province.